Most teens are proud of certain features they have. Some may wish that they have looked thinner or more muscular. What causes teens to develop a negative body image and to developing eating disorders? Body image is the way a person feels about his or her appearance and perceives that others view him or her. If you like the way your body looks, you have a positive body image. Many factors influence your body image. The opinions of other people might influence the way you see yourself. If people around you label you as fat, you might start to see yourself that way, even if you're not overweight. Cultural factors can also affect your body image. In some cultures, a heavier woman or man is considered more attractive. In societies that prize thinness, images of slender models might cause those with average or above average body weight to feel unattractive. Television, movies, and magazines might have an influence on your body image. These sources sometimes portray the ideal female as much thinner than most females actually are. The ideal male might have a lean, muscular body. These images might have a negative influence on a teen's body image. The average female model is 23% thinner than the average American female. It is important for most female teens to try to attain a model's body and stay healthy. It is impossible for them to accomplish that. Although females are more likely to dislike their bodies than males, some male teens have a negative body image too. They may take physical activity and exercise to an extreme level, spending hours each day at the gym. Some male teens take supplements and other substances to increase muscle mass, which is dangerous. An eating disorder is an emotional disorder in which a person chooses harmful eating patterns. Eating disorders affect at least 5 to 10 million Americans and are more common among women than men. There are 3 major eating disorders, and they are anorexia nervosa, bulimia nervosa, and binge eating. Anorexia nervosa is an eating disorder in which a person starves himself or herself and has a weight of 15% or more below normal. Anorexia nervosa occurs most often among female teens and young women, but occurs in males as well. About 5% of people who have anorexia nervosa die as a result of the disorder or the medical complication it causes. The risks of anorexia include malnutrition, damage to the kidneys, heart, and other body organs, irregular heart rate, fatigue and weakness, stomach pain and constipation, dull and yellow skin, dull hair and hair loss, growth of excess body hair to keep the body warm, and that is due to fat being being able to keep our body warmer. And then bulimia nervosa is an eating disorder in which a person eats a great deal of food in a short period and then rids the body of the food. People who have bulimia vomit after meals or abuse laxatives or diuretics. A laxative is a drug that helps a person have a bowel movement. A diuretic is a drug that increases the amount of urine the body excretes. Unlike people who have anorexia, people who have bulimia may be at a healthful weight. However, they are unable to control their behavior. The risks include damage and discoloration in tooth enamel from the acid that occurs in their vomit, swollen cheeks and face, sore gums, dry and brittle hair, irregular bowel movements, heartburn, stomach cramps, increase in their blood pressure, damage to colon, kidneys, and heart, rupture of the esophagus in extreme cases. And the last eating disorder is binge eating. It's an eating disorder in which a person engages in uncontrollable eating. Those who have the disorder may eat for hours in secret, even if they're not hungry. Unlike people who have bulimia, they do not purge. Researchers are trying to determine whether metabolism and chemicals in the brain cause binge eating disorder. Up to 40% of people who are obese may have binge eating disorder. Those who are obese and have binge eating disorder often become overweight at a younger age than people who do not have the disorder. They might also yo-yo diet, or lose and gain weight repeatedly, more often than others. The risks of binge eating include overweight or obesity, premature heart disease, high blood pressure, diabetes, and certain types of cancers. Teens at risk for an eating disorder worry about their appearance and compare themselves to others. They may wear baggy clothes to hide their bodies and eat when they are depressed, lonely, stressed, or angry. Each type of eating disorder is associated with specific behaviors. Teens who have anorexia may complain about being fat despite continued weight loss. To shed pounds, they may use diet pills or laxatives and exercise excessively. Teens who have anorexia may make excuses to avoid meals or situations involving food. At meals, they develop food rituals, such as eating foods in a certain order or chewing excessively. In addition, they are preoccupied with calories and fat grams. Teens who have bulimia regularly eat abnormally large quantities of food in a short period of time. After meals, they might excuse themselves to go to the bathroom. People with bulimia nervosa exercise excessively or compulsively and obsess over their weight and body shape. Signs of binge eating disorder include regularly eating until uncomfortably full, or eating a great deal of food rapidly. People who have this disorder gain excessive amounts of weight. Often they are embarrassed about their body image and the amount of food that they consume. They may display feelings of helplessness, hopelessness, or worthlessness. This is the treatment for teens who have eating disorders. Having an eating disorder is a serious health problem, but help is available. If you suspect that a friend has an eating disorder, encourage your friend to get help. Talk to a parent, guardian, teacher, nurse about your suspicions. If you suspect that you have an eating disorder, talk to a parent, guardian, or health professional as soon as possible. A person who has an eating disorder usually requires help from a team of caregivers. A medical doctor may treat physical ailments caused by the disease. Because many people who have eating disorders have emotional problems, mental health caregivers such as counselors also may assist the person. They may help him or her discover the causes of the eating disorder and work to eliminate them. Registered dietitians have knowledge of eating disorders and experience with helping people who have them. A dietitian may help the person learn to make responsible eating decisions. Family therapy is an important part of treatment in many cases. Responsible family members can help improve the body image of the person who has the disorder. Family counseling can help the person and the family deal with some of the problems that cause the disorder. It is important for teens who have an eating disorder to seek help as soon as possible. They can talk to their parents or guardians. A doctor, school nurse, or specialist at a mental health clinic can assist them. They can also access the website of the National Eating Disorders Organization. This organization provides free information and can refer the person to local groups that can help. Recovery from an eating disorder requires a lifelong commitment to prevent relapse.